welcoming you to the second of our discussion concerning COVID-19 and the African diaspora. This session is specifically entitled COVID-19 and the African Diaspora and International Forum. And it is being sponsored by the Association for the Study of the Worldwide African Diaspora, or ASWAD. And so I'd like to acknowledge Robert Trent Vincent, the president of ASWAD, as well as the members of the committee who developed this forum. That committee consists of Professors Laurie Lambert, Ben Talton, Bryce Henson, and Ana Lucia Araujo. So I want to thank them for their vision in putting this forum together. What I'd like to do is, and I am a member of ASWAD, and so I'm delighted to serve as the person who is facilitating the conversation. And what I would like to do at this point is to very briefly, in the interest of time, very briefly introduce our participants. They all have extensive CVs, and we simply don't have time to go through them. But I will introduce them in alphabetical order, beginning with Dr. Luciana Brito, who is an assistant professor at the Universidade Federal do Recôncavo da Bahia in Brazil. She is the author of the book Temores da África, or Fears of Africa, soon to be published in English. She is a working class feminist and member of the Black Women's Network of Bahia. Dr. Brito specializes in the history of slavery and abolition in Brazil and the US. She's also interested in the areas of race, gender, and class in the Americas. Next, we have Dr. Ugo Edu, who is an assistant professor in the Department of African American Studies at UCLA. Professor Edu is a medical anthropologist. She works at the intersection of medical anthropology, public health, Black feminism, and science, technology, and society studies. Her book project, The Family Planned, Racial Aesthetics, Sterilization, and Reproductive Fugitivity in Brazil, traces the influence of an economy of race, aesthetics, and sexuality on reproductive and sterilization practices of women in Brazil. Next, we have Dr. Julius Fobil. Professor Fobil is professor of environmental health and the dean of the School of Public Health at the University of Ghana. He's published widely on urban environmental health in low-income economies, with an emphasis on the impact of sanitation infrastructure, neighborhood environmental conditions, environmental change, and area-based socioeconomic inequalities on human health. Next, we have Dr. Aaron Kamugisha, who is the program coordinator and senior lecturer in cultural studies at the University of the West Indies at Cave Hill in Barbados. He is a member of the editorial working committee for the Journal of Social and Economic Studies. He is a member of the editorial advisory board of the Journal of West African Literature. He's a member of the editorial collective of the Journal of Small Acts. Professor Kamugisha has edited 5 collections on Caribbean thought, and he is the author of Beyond Coloniality: Citizenship and Freedom in the Caribbean Intellectual Freedom, simultaneously published by Indiana University Press and the University of Witwatersrand Press in 2019. We also have Dr. Angelique V. Nixon, lecturer and graduate studies coordinator at the Institute for Gender and Development Studies at the University of the West Indies at St. Augustine in Trinidad and Tobago. Dr. Nixon is a writer, teacher, scholar, activist, and poet. Her research areas include feminist praxis and discourse, Caribbean sexualities, sexual labor, and social justice movements. Professor Nixon is the author of the book Resisting Paradise, Tourism, Diaspora, and Sexuality in the Caribbean Culture. We will have joining us, I do believe, Dr. Maboula Soumahoro from France, and I will introduce her at the moment that she that she actually joins us. With that said, what I'd like to do is to attempt to connect our prior conversation of May 15th with what we will attempt to do today. And so I want to do that by providing a particular kind of framing with which you may agree or disagree. It's all right if you disagree. I will make the attempt anyway. As we speak, on May 26, 2020, the current total of infections globally, according to the Johns Hopkins website, is 5,530,341 persons. The United States accounts for 30% of that figure, with some 1,665,852 persons infected. Brazil has now, since our last meeting, Brazil is now second in the total number of infections, with 374,898, accounting for some 7% of the world's total. And as we speak, it is registering the fastest increase in the number of COVID-19 infections. So we want to specifically focus on the question of the impact of COVID-19 on African descendant populations around the world. And perhaps we can do that by making a number of reflections, observations, and I promise you that once I get through this, I will be essentially done, and the participants will, in fact, take the floor. We begin with observing that relative to the rest of the world, Africa continues to register a relatively low number of infections, although the slow, gradual rise is concerning. We are aware that South Africa has almost 24,000 people who have been diagnosed with the disease. Egypt, almost 18,000. In Nigeria, slightly over 8,000. So we are monitoring those rates. In Latin America and the Caribbean, there's a lot of concern there. A lot of populations, specifically in Latin America, suffering. The rates in Dominican Republic, Mexico, Panama are particularly alarming. The Johns Hopkins website now registers over 1,000 people in Haiti diagnosed with the disease. Jamaica, 556 people. Martinique and Guadeloupe, 197 and 161 respectively. And so we're monitoring that. And of course, I should state that, of course, all of these figures are questionable, in the absence of consistent testing, and in some instances, the absence of testing. So what we're looking at, in particular, in places like the United States, United Kingdom, Brazil, most likely France, although France does not aggregate its data with respect to race, the disease appears to be disproportionately impacting African descendant populations. If we drill down into the United States, for example, an analysis published on the 14th of May states that in New York City, where Black people make up 22% of the population, they are accounting for 28% of the fatalities. In Chicago, where Black people represent 30% of the population, they are accounting for 70% of the fatalities. In the state of Louisiana, 32% of that population is Black, but 70% of the COVID-19 fatalities are Black. The Center for Disease Control published a report on the 20th of this month of May, which finds that although Blacks comprise 12.5% of the US population, they are accounting for 22% of all of its deaths. So this has led to a growing discussion / debate over this disproportionality. That is to say, we understand that the coronavirus does not discriminate. The virus does not discriminate among populations, and it doesn't have any particular politics. But the way that it's being experienced is another matter. And so, of course, this has led to a conversation about why this is taking place. And part of the answer is that, you know, you have a disproportionate amount of African descendant persons who comprise the category of so-called essential workers. And I would just note that there was a time in this hemisphere when enslaved Africans were also essential workers. We were the quintessential workers. And so we have Black folks disproportionately working in hospital and nursing homes, making deliveries, driving taxis. They're Uber and Lyft drivers. They're working in grocery stores. They're working in these meat plants. They are performing the agricultural labor. And of course, we are overrepresented in our jails and prisons. Furthermore, our living conditions are characterized by cramped quarters. We have multi-generational homes. This is influenced not only by culture, but also by conditions of poverty. And as a consequence, there's an inability to socially distance. I think the more controversial question tends to orbit around this question of comorbidity. And the finding that African descendant populations, Latinx populations, tend to have high blood pressure, diabetes, asthma, or obesity as vulnerabilities that impact these populations more so than others. But then the question emerges, well, why the comorbidity? And the response has been, you know, that these populations live in food deserts. They're impacted by environmental racism. There's an absence of quality medical care. Companies tend to actually target these populations with sugary products and so forth and so on. That is to say, the debate is emerging as to how, you know, the Black body is being presented in the media. And is this something that, and are Black people suffering from COVID-19 disproportionately because of some innate propensity, or are there other factors involved? So I think that that kind of summary articulates with our earlier discussion on May 15th. And I would like to yield the floor to anyone who would like to respond to any of those points, and then we will proceed. Yes, Professor Brito. You need to unmute yourself.
Okay.
There you are.
Okay, be done. So hello, Dr. Gomes. Hello, all my colleagues with who I share this conversation, all the participants. Thank you, Laurie, for organizing this panel. I have a lot of things to share with you guys. Since the last conversation we had, I have the impression that the pandemic has been making more evident that this crisis also brought a workforce crisis in terms of making this breaking a circle. People have to work because they are poor, and going to work, they use the public transportation, and they are more exposed, more vulnerable. They go home and make people, you know, can make people sick, and this is a circle. So since the last conversation, I was really impressed about how the situation in Brazil, first of all, is really similar to the United States. And I wish I have the opportunity to talk to you guys about the militias and the protesters that are happening in the United States. I wish I have opportunity to hear from you guys about it. I see a movement happening in Brazil. So right now in Brazil, the government is debating how to make people, any civilian, have guns. This is the debate that is going on in Brazil. And according to the president, he is saying that civilians have to have guns to protect the government and to defend their rights to go wherever they want to go, which means to disrespect the isolation policies and the lockdowns. So, of course, some situation in Brazil is really similar to the United States, but it is really surprising to me. I expected to be more similar to Africa continent and the Caribbeans because of the characteristics of our population. But how our situation in Brazil, in the multiracial societies, are more similar. Brazil, United States, and European countries. Our other colleague talked about France, and I was surprised about how the situation in Brazil is more similar to France than the Caribbean in terms of the people who are getting more infected disproportionately, and about how the governments and the entrepreneurs are dealing with the workforce, which is Black and Latino and immigrant in these multiracial societies. To me, and I want to hear from you guys, is that in those multiracial societies, in those societies who have a more, how can I say, the others, like the United States, in Brazil, and here in Brazil, I'm calling the majority, the Black, the poor, the others, which is a crazy analogy to do, called the majority of the population, the others. But, you know, in political and social terms, we are the others. So how in the United States, in Europe, and in Brazil, the crisis of work conditions, living conditions, are making people more vulnerable, and how in these people who are more vulnerable are the racial other ones. I think that this makes more evident how in terms of the class and how the others compose this majority vulnerable workforce, make more evident the racial disparities in this society.
Thank you, Dr. Brito. Others? Would anyone else like to respond to any of these issues? Yes, Dr. Nixon. Yes, unmute yourself.
Thanks, I did. Thank you.
Okay.
Thank you, everyone. Thank you, Dr. Brito, for that really important opening for us to really think through the complexity of race. And I would also add class and gender and sexuality, right? Because I think it's this, what COVID-19 has unearthed for us is that the existing inequalities that I think in many societies we try to pretend they don't exist, or, you know, the discourses, especially I think in the global north, and progress is that we are moving to some kind of post-racial, post-gender, post society and world. And I think that what COVID-19 and the response to it has demonstrated to us again and again in such devastating ways is that we are not there in no way, and that the inequalities that exist in any society and in any country are exacerbated in this moment in ways that are so devastating. When we think about what's happening with indigenous people. I think it's really important for us to acknowledge that too, because it's so invisible. It's invisible in the United States, and it's invisible across Latin America as well. And when we think about poor and working class people who were already, right, the whole idea of being able to socially distance or be able to stay at home, I mean, that is a privilege for so many people. That is not possible. And so when you think about Latin America and the Caribbean in particular as being an already vulnerable region around economy, from the issue of daily wage earners, the ways in which migrants are particularly vulnerable, the ways in which our economies are vulnerable to tourism. And so when tourism shut down, right, and I mean, I'm sure Aaron will talk about this as well, when we think about our tourism dependent economies, like we might be COVID-19 free in terms of active cases in a number of Anglophone Caribbean countries, but we are facing a most certain, and dismal future around what our economy is going to do. Many people live paycheck to paycheck, month to month. And even though our governments, I think Trinidad has been able to really uphold some of the social services to keep people afloat, we're all concerned. I think we're all worried. And I wanted to talk about, throw out there that when we think about how white supremacy works as an invisible force in our multi-racial societies, even when you have majority brown and Black folks, we see it operating, and we see how racial, gendered, and I would add sexual others and poor and working class folks are made more and more vulnerable and disposable in a way. And that is what really concerns me, and I'm sure concerns all of us.
Thank you, Dr. Nixon. Yes, Dr. Kamugisha.
Yes. Thanks also to Dr. Lambert for inviting me to participate in this discussion. I want to return to Dr. Nixon's point she raised very well on the Caribbean, and to give more of a sense of the state of the Caribbean, particularly the Eastern Caribbean. The good news, of course, is that in the Eastern Caribbean, there are many countries that have few or no active cases. So St. Lucia, Dominica, St. Kitts, there are no active cases at all of COVID there. Barbados, Grenada, Antigua, St. Vincent, less than 20 active cases in each of those countries. So that is the good news. Now to get into the rest of the news. We're talking, if we think about the Caribbean, about a wider picture of climate change devastation over the last few years of the hurricanes, economic precariousness since 2008, IMF structural adjustment programs, all of these contributing to the current condition of the Caribbean. With COVID now, as Dr. Nixon has pointed out, tourism has largely been destroyed. And the kind of impact of that, I'll give the example of Antigua. Antigua is a country of 90,000 people. Within the first couple of weeks of the lockdown, over 20,000 jobs have been lost in Antigua. And all of the countries are experiencing those similar kinds of problems, except for Trinidad and Tobago, which of course is mainly an oil and gas country. There is also the problem and the difficulty of getting good statistics on what's actually going on. I don't know that there has been any wide-scale testing for antibodies to COVID in the Caribbean. So it's very difficult to actually tell how much the reach of COVID actually has been in a number of these relatively small countries. It's also difficult to even assess some of these unemployment rates, since there's so much casual unemployment in the informal economy in the Caribbean. And this is a region in which a 20% unemployment rate is not a strange thing in many Caribbean countries, but the actual unemployment rate may well be north of 30% in all of the Eastern Caribbean at the moment. Another question besides tourism that has to be put on the table when we think about the Caribbean, and I think a great deal of the African diaspora, is the question of remittances. Now, for a number of Caribbean countries, certainly I believe the Dominican Republic, Jamaica, remittances is the second biggest form of foreign exchange earnings. These remittances, again, I speak tentatively in the absence of very good figures, but we can think that they've been largely cut off as a result of COVID and as a result of what's been happening with COVID. There is also the question of the importation of food and medicine, critically to the Caribbean. The Caribbean is the most food import dependent region in the world. And one of the things that we can hope will come out of COVID is a greater move towards regional food security, even though that means breaking up all kinds of economic arrangements, which of course privilege food coming from metropolitan countries. And lastly, and far from least, we have the hurricane season, which starts officially in a few days' time. It has already started. There's already been one named Storm. And literally, I'm in Barbados at the moment where there is a tropical wave set to pass tonight into tomorrow. And all predictions are by the climatologists that this will be extra active hurricane season at the very time of COVID. And as we've seen since 2017, there is always at least one Caribbean country that has had an extremely devastating impact from the hurricane season due largely to climate change. So that's the scenario that we are faced with in the Eastern Caribbean. We can expect that when the Caribbean countries open up their airports again, which is now slated to come for a number of them, I believe at the beginning of July or the end of June, we will see a resurgence of COVID cases at that time. And that will really test the true resilience of our healthcare systems, which have been managing so far to deal with the pandemic.
Thank you, Dr. Kamugisha. Before we get to Dr. Fobil, can you tell us what is Barbados doing, given that the country is about to reopen relatively soon? What measures will the country take in order to try to mitigate the impact of tourists coming back to your place?
Well, I mean, immediately, of course, there have been certain facilities set up to quarantine people who are diagnosed with COVID. So they built in relatively short order a 120-room facility in the north of the island. There are about 2 other facilities. But of course, this is nothing that can actually contain mass tourism coming back into the country. We are not sure because at the moment the rule is that, and of course there are no flights coming in, there are no commercial flights coming in, but the rule is if you actually come into the country, you have to undergo a 2-week mandatory quarantine at a government facility. Okay, whether you're tested or not, you go straight to a government facility for 2 weeks. That, of course, is completely untenable with borders being open. Okay, there simply aren't enough places to actually house all of these people. So there is a great deal of uncertainty about what is actually going to happen at that time. The suggestion has been made that rapid testing could be done with almost the idea, which I consider quite fanciful, that everybody on landing in the country would be tested for COVID through the rapid testing capabilities. Even if that were possible in terms of the thousands of tests that would be needed every day, those tests, my understanding at least is, are notoriously unreliable. And the failure rate of those tests make them a situation. We all know, we all have a sense of how difficult it is for those tests to actually accurately predict or to capture everybody who may be asymptomatic from the disease. So Caribbean countries are in a bind. When they open, without a doubt, there will be a tremendous upsurgence in cases of COVID.
Thank you so much, Dr. Kamugisha. Dr. Fobil.
So I don't even know where to start, but I'm just thinking about what is going to happen tomorrow, for example, we have a situation where this disease is, the virus is spreading very rapidly. So the last week, was it like, I think when we had, this was 15th, so the numbers in Ghana, the numbers in Ghana were like 5,000, it's risen to 6,000 plus now, as we speak today. But the good news is that there has been also, you know, a lot more recoveries. Like recoveries are also huge. We have 2,000 recoveries, and we still have low deaths. But the question is, how is it going to be tomorrow, next week, next month, and what have you? Now, most people think that testing is the solution. But if we test, first, testing is good because it actually reveals the magnitude of the problem. But the question remains, what is humanity doing? What are we doing? First, there's no vaccine yet inside. Most people are promising, but I can tell you, we do know that the past pandemic and some of the viruses that we've seen, this one actually acts a bit differently and strange in the sense that we don't fully understand. I mean, we have tried, I mean, there's full information on like, okay, it's transmitted through droplets and, you know, and whether we don't know how large should droplets be to make impact or how small should droplets be. This hasn't been investigated, and this still baffles biomedical scientists. So I have also had conversation. I think yesterday I was listening to one of the popular TV channel in Ghana, and the people, the panel that was invited, they were kind of like, well, we just have to learn to live with this disease. And most of them tried to equate the coronavirus to HIV virus. But none of the panel members actually, you know, acknowledge the fact that the transmission mechanism is totally different between the two viruses. One, HIV is based on like blood-based and fluid in terms of this, and then you also, it's sexually transmitted. Unless, of course, okay, there's also blood transfusion. But then this one is airborne, and that is the problem we have. Most people, and especially on the African continent, are asymptomatic. So which is why it is quite critical that testing is important. But then you can only test and say, yes, A has it and B doesn't have, or C has it. What happened? Treatments are different. So, and I can tell you what happens, what's going on in Ghana here. So the basic thing is the treatment are same. Use some of the antimicrobials, antivirals that they use to treat. Chloroquine is one of them, but people are also using the same. But what we are really not seeing the kind of aggressive medical treatment that we have had reported in Europe and in North America. We don't. And yet, we don't see wide-scale deaths. So that tells me that something is happening in our population. And so we need to sort of investigate, intensify this thing and find out what are the reasons, and then we can take advantage. So I think that for us, in the last, when we had this conversation, I was kind of like narrowly saying, okay, there was no question of race in it. But then when my colleagues started to speak and I realized that they were conceptualizing race in a broader context to, you know, to include socioeconomic other than just biomedical, then I tended to agree that, okay, but the way the virus is constructed, we haven't found evidence that there is a biological factor in terms of like genetic constitution, in terms of how humans are constructed, whether there's a clear difference between the black and the white. No, we haven't found that evidence because we have studied many population, and in fact, currently we have, kidney disease, for example, is a major problem in African continent now, and also in North America. And I'm associated with a certain consortium that's looking at the genetic explanation of this. And what we have found is that there is a genetic marker, which when it is present in the population, it has about 20%, displays 20% of kidney disease progression and outcomes. When it comes to African population on the continent, other than African American, then it is worse off because it goes up to like 26%. So then the question is, what accounted for the extra 6%? So then we've intensified investigation, and we are realizing that environmental exposures are responsible for this. So I mean, in a much broader context, I think the virus is giving us a lot of hassle or a puzzle to unravel, and I think that we need to progress very rapidly, but at the same time, very cautious, because there's a lot more to learn, which we haven't been doing much. And that I've criticized the science, like African scientists, that we are not really aggressive in like trying to construct African stories. Because I think COVID presents, despite the fact that COVID presents a huge problem for the world, there are also opportunities that African race, we can really construct more positive stories for ourselves.
Thank you, Dr. Fobil. Thank you so much. Okay, Professor Edu, the floor is yours.
Great, thank you. And thank you again to all of you that have put this opportunity together for us and convened this again. Yeah, I'll start by just updating from last time when I spoke about Nigeria. I think the cases were about 5,000, and they've since increased to about 8,068 total cases, with 5,524 of them being active. And again, we've discharged 2,311 people, and we've had 233 deaths. And again, for Nigeria, the way that, just thinking about some of the previous comments, the way that it kind of entered Nigeria seemed to be a disease of the elite, those who were able to be mobile and could travel out and could come in, whether they were actual Nigerians or, as the first case was supposed to be an Italian working for one of the companies here in Nigeria. So some of the things that people were saying was, I'm someone that doesn't even have a passport, how am I gonna get this disease that's coming from outside? And so some of the big concerns were how to make sure this doesn't reach community spread because of, again, this question of high rates of poverty, high rates of people living in very close, cramped quarters, the kind of proximity people have when they're taking public transport to go to work, the reliance of most people on informal economy, so they have to work every day and they're living hand to mouth. And then also just whether it's been possible to have a lockdown, right? Because how are people going to eat? How are people going to survive when they can't go out and work and we don't have the kind of social networks that are imagined to exist in places like the US or Europe, and even Latin America. And, you know, we have to also talk about the question of brain drain. So a lot of our professionals have left the country because they just aren't able to find employment that's fulfilling, that makes sense for them. Also poor healthcare infrastructure. I know when the virus first hit, a lot of people were asking their politicians to now go to these same clinics that they had boasted about putting all this money into building for the people, even though they themselves would often travel out for you know, something as simple as a headache, right? So I think those have been some of the biggest concerns, and you can think about the way that structural adjustment has affected the way that Nigeria can spend money. And this is not to exempt the leaders from their own corruption as well, but when you're having to pay back debts, you can't pay for good education. You can't put that money into education. You can't put that money into healthcare. You can't put it into social welfare. And I think those are some of the ways I think about the way that white supremacy seeps into the African context and structures, who is susceptible to disease and who is most likely to bear the brunt of what COVID-19 looks like. And so a lot of people are not even really worried about COVID-19. They're worried about not dying of hunger, not dying of malaria, which is still killing lots of people, not dying of Lassa fever, and some of the other epidemics that folks are having to contend with on a regular basis. Something as simple as diarrhea, typhoid, right, which are still concerns that take precedence for many folks over COVID-19, which is in many ways imaginary. It's not something that has touched people in very tangible ways or real ways.
Dr.
Yeah.
Ed, ask you a question. So Nigeria is this massive, massive place, no? How is it being experienced differentially between north, south, southwestern part of the country, southeastern part of the country where you are? I mean, how is that playing out?
Yeah, absolutely. Lagos is one of the epicenters, which, I mean, makes sense. It's very highly populated. It's also like the financial capital for the country, as well as the capital, Abuja. And a lot of the northern states have been highly affected by COVID-19. In the Southwest, you also have cases. It varies. I think there are about 2 states that have managed to still not record any cases. And I say that record any cases because you can ask whether testing is going on, and questions around why they haven't recorded cases. But I would say, yeah, the Lagos and the North are seem to have the highest number of cases, and Lagos has the highest.
Okay, so we're going to move on, and I want to
I think you're muted now, Professor.
Oh, am I? Okay, let's see what's happening here. Okay, am I back now?
You're back.
Okay, sorry about that. I lost contact there. Professor Edu, you were making some important points. Were you able to finish your points?
Sorry, I forgot to unmute myself. I was just saying that Lagos has the highest number of cases, and the federal, Abuja, and a lot of the northern states have a lot of the highest cases, like Kanu, Katsina.
Okay, all right, fantastic. So maybe we can segue into this discussion. I think that Dr. Nixon raised the question of class and gender, and at least she raised it initially, and I would very much like to kind of segue into that and you know, ask, how is this pandemic being, how is it unfolding with respect to gender and class and sexuality? We've talked about race, and we can come back to that, and that's, you know, probably going to be the ongoing context for it, but we can certainly also begin to discuss this in, you know, multidimensionally.
Well, yes.
Yes, okay, yes, please, go ahead.
I mean, yeah, so we have to think about it through, you know, how these things intersect, right? Because we don't exist only as one or the other. And so I think that's really important to think about intersectionality and the margins, and how these different experiences of identity, social and economic class, race, gender, and sexuality, geographic location, and migrant status and nationality all impact how people might experience crises. And I think, you know, feminist scholars, particularly post-colonial and of the African diaspora, and certainly in the Caribbean, have offered so many different ways to analyze and think about the social and economic challenges faced by various spaces, and how that is gendered, how they're gendered, how they're racialized, how class impacts, and so on. And so one of the things I'm going to bring up right away, of course, is gender-based violence. I mean, the entire region, and indeed the world, we still have serious issues and challenges with gender-based violence. And during the lockdown, a number of women's organizations in the region alerted folks and said, you know, we really have to think about this. I mean, in Trinidad and Tobago, in our organizing work around gender-based violence, we've been talking about it as a national crisis, because it is. And I think other countries experience the same levels of, you know, 1 out of 3 women experience some form of sexual or physical assault in her lifetime. And in fact, in Latin America and the Caribbean, the numbers are suggested to be higher, especially for intimate partner violence. So you can imagine during a lockdown how that might exacerbate the issue. And we've indeed seen that across the world, right? All across the global South and the global North. The call centers experiencing high rates of reports, police reporting higher rates of intimate partner violence and domestic violence calls and reports. So we know this is an issue, and we know that certainly the tensions that arise during economic crises then exacerbate forms of violence. So I think it's important to note that. Also, you know, we spoke earlier a little about, you know, the essential workers and frontline workers, and also the informal economy, which is also gendered, right? And we think about the amounts of people who could not stay home and we're still working, many of whom are women, and the kind of double and triple work that women then experience in the home by doing care work for elders, for children. And so working a full day or night shifts, etc., and then having to come home or do care work and think about their own health and their family's health. I think that's also something that's very gendered and also classed, right? And then I just want to mention finally, the issue of folks who do different kinds of informal work, like people who do sex work, folks who are migrants, who are particularly vulnerable, and that is its own set of challenges. In Trinidad and Tobago, I've been doing work helping to raise, to get supplies and support for people who are trans, people who are sex workers, people who are migrants, and also persons living with HIV. And those are different kinds of vulnerabilities that have a very particular social and economic class status, and also, you know, invisible. And so I want to raise those, and I leave it there, and would love to hear what other people think and what you might be doing in your own spaces.
Dr. Nixon, I appreciate that. Thank you so much for that. And And before others respond, may I ask in Trinidad and Tobago, what has been the response to your activism around these issues? I mean, are you able to discern or detect any sort of decline in domestic violence or the sort, or do you have any sense of knowing whether or not your efforts are having an impact?
Well, I mean, in recent news and in the work that I do, no, there's no decline. In fact, the numbers have gone up, and it's been an alarming rate of reports of domestic violence to the police service and to the hotlines. The shelters here in Trinidad and Tobago have been calling for more support, and in fact, women's organizations have also been calling for support, as well as the Institute for Gender and Development Studies, for the government to include attention to gender and a specific focus on gender-based violence in the COVID-19 response. So there's a lot of work to be done.
Okay, thank you. Professor Brito, would you like to speak to this issue as well? Because I've been reading a lot on this issue of domestic violence in Latin America. It seems to be really a real problem under the pandemic. It's always been a problem, but I mean, it's been accelerated. Yes, accentuated, yes.
So yes, in Brazil, the numbers, since more people are inside the house, the numbers of domestic violence are growing really fast. It's already a public problem. The first is to denounce the problem were the feminist groups, especially the Black feminist groups, who, looking at the numbers in China, previewed that the same would happen in Brazil, and it did happen. So after a lot of pressure, the federal government recently, I think that since last week, made a propaganda, but the propaganda has a lot of problems. First of all, is all white people, but in a certain way, is even better that this government don't represent Black people at all on the propaganda. And the first propaganda that they put was a old white man holding a paper sign saying, "I live with my enemy." And on his back, there was a silhouette of a woman. So they reversed the demands on public campaigns, yes, on domestic violence. And they transform in a above gender thing, although the numbers say that most of the cases involve women and kids and elders. So the numbers of I'm on my head to talk about police brutality, and don't forget, so, of domestic violence are really high because everybody's inside the house. Also, in terms of gender, we see, sometimes I drive around the city and I can see most of the people in the bus stops waiting. The bus stops are crowded. People are wearing masks because now it's mandatory in my city in Salvador to wear masks. But you see people wearing masks in all parts of the face. And as soon as people get more comfortable, they take off the masks to chat. So I see more women in the bus stops waiting to go home and to take the public transportation. So that explains information that I brought last week about a research made in São Paulo, which is the center of the pandemic in Brazil. This research found out that most of people infected in favelas are women. And although Dr. Fobil is right, we really don't have information about any race that the virus prefer, let's say. We know that the virus is more, men are more vulnerable to the virus. These are the researches. But in Brazil, because women are more vulnerable and participate more in the workforce, they are the majority of the infected people, young women between 25 and 40 something. So it's the age of the workforce, of the majority of the workforce. So this make a disease of the majority of women, especially if we are talking about younger people, this age of between 25 and 40 something. The other aspect of gender and class and race in the pandemic is about the financial support. After a long pressure of the Supreme Court, the Chamber of Deputies, in the society, finally the government start to pay people, unemployed people under the poverty rates, people in financial vulnerability. They start to pay this money, like today is $100, but like 600 reais to the families. But the thing is, in order to receive this money is only paid in a bank, and people don't have to have problems with the CPF, which is our social security number. This brought a lot of problems in the poor community because a lot of people, I don't know exactly the numbers now, but a lot of people don't have or have problems with the social security number. And most of these people who depend on this money are women with kids. So this reveals a lot of how gender and racialized poverty is. So there is a lot of initiatives of the social movements of Black women networks, and in order to collect money for these women who are not allowed to receive money, is a problem that the federal government still didn't solve. And from women for women who are incarcerated and need basic, stuff like soap and basic stuff like cleaning supplies. And they are incarcerated. In Brazil, we still don't have they want to put the incarcerated population in containers. So those who are tested positive in Brazil, the idea of the federal government is to put the incarcerated population, include the women with the kids, in containers. Another aspect of this, how gender this pandemic is about our national test to enter in the university. I don't know how you guys call in your each country. In Brazil, it's called ENEM. It's like a high school national test that the students have to take in order to enter in college. I know that in most of the countries, these tests are suspended, but in Brazil, only last week, finally the federal government, when they saw the possibility of losing the Supreme Court, the persistence of maintaining the test, the national test, they finally suspended. And there was a huge mobilization in Brazil because over 60% of the Brazilian students don't have access to internet. So they cannot study, the classes are suspended, everybody's inside the house, or all these young people. They don't have Wi-Fi, they don't have internet in order to continue to study, although our Minister of Education said that the objective of the national test was not to confront social disparities. And since it's a competition, it's part of the competition, those who are more able and have more condition take advantage of the situation. So in my view, this situation, the national test was finally suspended. But I know, especially based on my students, those who are doing domestic work, who are cooking, who are cleaning, who are taking care of the elders, and the kids are women of all ages. So we are professors, and can we imagine, young women who are in the house, so they have no conditions to study now, since they have all these activities, domestic activities to do, and they don't, most of these students don't have a good quality or none at all Wi-Fi in order to study. So I think that all these aspects reveal how gender, class, and then because of that, race, of course, is not a biological thing, but social and political, race end up making more evident the disparities during the pandemic.
Well, this pandemic is certainly unfolding in a global political context that couldn't be more unfortunate. That is to say, in countries like the United States with Mr. Trump, and in Brazil with Bolsonaro, and the UK with Boris Johnson, and so forth. I mean, we in these countries, we're in a moment in which the political leadership is essentially non-existent, and is beyond racist, and so consequently, we are experiencing certain kinds of challenges, and I imagine that we're preparing to engage with the electoral process with the idea of trying to affect some sort of change down the road. So we'll see how that works out. I want to talk about that a bit more with respect to the kinds of structural issues that we're faced with respect to global capitalism, neoliberalism, and so forth, and how that is impacting our lives. But before I do that, I wanted to give our colleagues in the Caribbean and in West Africa an opportunity to talk about arguably, and you can let me know if I'm wrong about this, but arguably you're in a different situation in that your countries are not being led by the Trumps and Bolsonaros of the world, and so consequently, presumably the governments are a bit more responsive to the constituencies. Are there ways that you would like to see the state better engage those constituencies? That is to say, what sorts of policies? I'm not asking you to engage in a critique of your governments, but are there policies that you would like to see enacted by your governments that could really facilitate this, facilitate the struggle against this particular pandemic, and indeed get at some of the structural issues that make our community so vulnerable? If anyone would like to respond to that. Yes, Professor Edu. Yes.
Yeah, I think if they did what they said they were going to do, that would be one good start, right? So a lot of the federal government talked about providing palliatives and financial support to folks who are most needy. And to date, it's yet to be seen where that money has gone to, that's been donated to government, where these palliatives actually are. Just things like even constant light. You're asking people to stay at home, and you want people to stay at home in hot homes that don't have any electricity, don't have running water. How will they wash their hands? Actually putting money into healthcare like they say they're going to do, right? So we actually have clinics and hospitals that can provide primary, secondary, tertiary care. So we can actually have isolation centers that make sense for people to stay in while they quarantine themselves. So I think just if even at the baseline they just did that, just did what they are saying that they're actually doing, that would be a great way to start to help folks address COVID-19. So I think a lot of the doubt and disbelief around COVID-19 that I hear people talking about is just because of what the government is not doing. Their failure to kind of, so in Cross River where I'm at, we have a no mask, no movement policy that's supposed to be in place. Yet, similar to what Dr. Brito was saying, you see this case where people are wearing their masks like this and walking around, and when they get into a taxi and you reach a checkpoint, you now pull it up, you pass the checkpoint, you take it off, right? So, But again, because there is no actual implementation, and even if they were to implement it, the other things that are supposed to kind of follow to support people staying at home aren't in place. So I would say if they just did that, that would be a great start.
Thank you. Yes, Dr. Kamugisha.
Yes. Let me start by saying that the lockdown in Barbados and I think the Eastern Caribbean has certainly caused a great deal of a consternation and anguish that it has in many places. However, one of the things is also shown, even though you're right to say that we don't quite have Bolsonaro's or Trump's here, is the authoritarian tendencies and the impulses and the surveillance impulses of the Caribbean state. I mean, one of the first things that we saw after the lockdown, one of the first people who are being arrested are, of course, sex workers who are breaking curfew, migrant workers. There is immediately that targeting of vulnerable people. And the initial fines in Barbados, it was something like a maximum fine of $50,000 divided by 2 for the US or 6 months in prison. And there were people who are convicted and sent to prison for 6 months for breaking the curfew in the initial days. Okay, I mean, the response was dreadfully heavy-handed, and it was very, it laid bare the lack of any kind of criminal justice system because persons who had lawyers or who could make certain arguments obviously had the greater a possibility of getting off or gaming the system in certain kinds of ways. So certainly let's acknowledge that that's going on. We have a lessening in the lockdown at the moment in Barbados, but at the same time, there is still technically a 24-hour curfew. So there are all of these things that you can go out to do. You have designated days in which you can shop. You can go to the beach, which of course is a very good thing, twice a day. You're always able to go out for medical treatment, those kinds of things. But what the police are doing is that if they grab you or they get you on the street and you can't give a good justification, and for some reasons they want to arrest you, they're arresting you for breaking the curfew, even though there are hundreds and thousands of people who are also out at that particular point in time. The ways in which the Caribbean state is actually using these policies has been thoroughly revolting on many levels. And I just want to put that on the table to start. However, in terms of specific policies they could do, the healthcare response has not been that bad given the resources that are available here in Barbados, even though there has been an absence of the antibody testing, and more testing certainly needs to be done to get a good picture of what's going on. But I think that one of the most important initiatives is going to be the initiative around food security and the question of food security, and understanding that food security in the context of a Caribbean demands a regional response. It can't be the response of one government, particularly in some of the tourism-dependent islands in which it is so clear they have never actually produced enough food to feed themselves since the inception of these islands, the colonization of these islands in the 1600s. So there has to be a regional response. The Caribbean certainly shouldn't be importing billions of dollars of food from the United States, Europe, and other countries, but there becomes a question of the will to coordinate that response. And that is a response which would have tremendous consequences to the benefit of Caribbean people for decades after the pandemic is over, if Caribbean governments take the initiative to do what they have to do at this moment in time.
Oh, thank you so much, Professor. Anyone else from the Caribbean or West Africa would like to comment on this question of government response?
Yeah, so I wanted to, oh, okay.
Oh, should I go?
Yes, please go
please.
ahead.
Oh, okay. Hi. Just adding to Dr. Kamugisha's points, but also thinking specifically about the authoritarian tendencies. I think that's something we all need to think through and critique, because those are particularly harmful even in our spaces where we could say that we're, you know, majority run in terms of our politics, but still there are challenges, I think, when we think about our criminal injustice system, as I like to call it, and also our healthcare systems that are that have been okay so far. But as you know, we suspect as cases rise, we have very, very scary. We are in a scary moment to think about what could happen if we had more cases, and also the kind of private-public partnerships that have happened around healthcare and other systems where we are not in a fully socialized healthcare system, but rather we have these competing and often structurally adjustment-led models of healthcare that I think are really harmful. And so one of the things that I think we need to think about, food security, absolutely. And I've, you know, pitched this idea that what if we as a region, you know, would ground ourselves in thinking about regional mutual aid and a South-South interdependence. So we're not looking to the global north to import food, but rather we're sharing in what we produce, turning to places like Cuba that has a remarkable healthcare system and also grows a lot of its own food. And if we can think about how we feed ourselves, how we heal ourselves, and how we support ourselves. And those are some of the things that I've thought really deeply about. And I'm really saddened to see that we are immediately thinking about how can we open up, go back to tourism, dependency, get those foreign dollars in. And as soon as we open up the borders, we are going to be in trouble, I think. And so I was hoping that we would move away from those neoliberal agendas and reject the foreign aid, but the IMF is very resilient in their sharing of, oh, look, we have loans, right? And I think many countries in the global south are taking IMF recovery loans, and that is what's really, really scary. And so for me, I think we need policies and we need regional solidarity, and I think expanding that to all of Latin America and the Caribbean, and indeed other parts of the global south, to say, no, we're not going to do that. We're going to create a different model, and we need it immediately.
Thank you, Dr. Dixon. Dr. Nixon. Professor Fobil. Professor Fobil, were you going to speak?
Let me, so I wanted to add a little bit to what Dr. Edu said. Your specific question was what policies governments are taking. Yes, in Ghana, for example, there's a rule and all the institutions will still go to work partially. Things are a bit relaxed now, but just that we still have a lot of restrictions. And this is government policy. Number two is that, I mean, there can't be any global level policy because they affect people at, you know, different categories of people differently. And, you know, the question is, well, I just think that I don't fully trust our government. And I would like to speak really candidly. Well, governments don't really live up to their words. There's a lot of talk and literally no action. I've been involved in national containment strategy development and what have you, and I have set up a team and I'm leading a sub section of the team to really, you know, conduct modeling of the disease. And I can tell you, part of in fact, the largest testing center is located in my university. And I tell you, we've been asking for real-time data to really do independent analysis of the data that are being churned out. I have gone to government side, it's not working, and I have had to come back and apply using my my role as part of the university to the director of the testing center at the Noguchi Memorial Institute for Medical Research. So right now, there's going to be a meeting, and this is, so government really don't do anything. All they do is talk. What you hear is, we are saying we will provide this for this subset of people, but it doesn't work. Even during lockdown, they've had to, lift up the lockdown situation because certain categories of a large section of the population was hurting. Like a large chunk of the people who were living from hand to mouth were really struggling to cope with the 2-3 weeks of lockdown that we had. And so the government was pressurized to lift the lockdown, because literally they had said, I know that if government were serious, it was possible to keep the lockdown situation and provide for the subpopulation that didn't have adequate finances to survive during the lockdown. If you take Accra population, let me put it at 4 million people. And but that's just to say that everybody in Accra, including the floating population, of course, nighttime, everybody goes back to where they come from, and this is really not Accra itself. So if you gave Accra 4 million people, and during the lockdown, government came out with figures, financial figures, saying that they were spending 2 million Ghana cedis to provide food for the population that needed the food to survive. Now, 2 million divided by 4 million would be like probably 50 cedis per head. This is a lot. And if you compare that to the food that is supplied to each individual per day, that was laughable. It would never compare to 50 cedis Ghana. I would not, if I go to one of the rich restaurants, I'm not going to spend up to like 50 Ghana cedis on a meal. So the question is, but that's even just the total population, but the segment of the population that needed this is not up to maybe 2 million people. So in fact, the government was claiming if that was true, and you were to take, it would mean that each individual was getting 1,000 Ghana cedis a day. And compared to what people really receive, that is really not true again. So you see, we can't trust our government, and that is also giving a huge cause for concern, because COVID itself may not have been, the impact would not have been the way we are feeling it if government was honest and political leaders took this issue seriously, and they were very committed to doing or helping the population. So, well, if I was to sort of, analyze the impact of COVID, I will be careful in doing this, because part of the effective impact is not the virus itself, it's not the disease itself. It is also government failure, government inaction, and government lies. Because if I were to build a model to estimate the impact of COVID on the population, I will have to add this as a component. Thank you.
Thank you, Professor Fobil. Well, at this juncture, I want to pause, because we have joining us, as I alluded to at the beginning of the session, we have joining us Dr. Maboula Soumahoro, who's an associate professor in the English department at the University of Tours in France. Professor Soumahoro is an activist, a writer, an academic, She's involved in issues related to racism and Black and African culture in France and the broader African diaspora. And she has conducted research and taught in several universities and prisons in the United States and France. She is the author of Le Triangle et l'Hexagone, Réflexions sur une identité noire. Parenthetically, Black is the Journey, Africana the Name, is to be published by Les Découvertes in February of 2020. Welcome, Professor Soumahoro. And I would like to give you the floor by asking you to respond to a kind of open-ended question. It's the kind of question that I know that you are, it's a good question for you, and you can help us to engage or to widen our scope by responding to the question, what would you say are the most important lessons that we can learn or draw from this pandemic experience?
Good afternoon, everyone. I don't know if it's morning or night, wherever we may find ourselves in the diaspora, but right here it's almost 7. I mean, it's after 7 p.m., so I don't know what to say. Sorry, I'm sorry I couldn't join you earlier. And Professor Gomez, you've asked me a very deep and profound, complex question. The lessons that we can draw and the lessons that we will have to draw, because I believe that we're still in the middle of the crisis. And I think that, I think this is what my colleague just said, beyond the medical aspect to the question, and we know that people are still dying all over the world or are being infected. I think that there's a looming, both social and economic crisis that might last longer than the pandemic itself. So I think that one of the lessons we can draw from the current moments has to do with, I don't know, perhaps the past crisis that humanity has gone through, that the African diaspora has gone through. That is to say, moments that are so tense, that are so fatal, that are so causing so many casualties, but that at the same time may be moments of that may allow novelty, that may allow creativity, that may allow some type of rebirth. And I think that throughout history, there have been moments like these. And right now we are experiencing firsthand one of those moments. I think we're all specialists in our respective fields, and we have read so much, conducted so much research on those moments. And now we find ourselves in living those moments. So should we remember the past, or should we, but also I think we can do both. Remember the past, but also allow ourselves to perhaps consider things that are new, that have never been done. I'm not practical enough to know, what can be done, but I think that these moments of crisis are also moments of possibilities. And the possibilities only because those moments of crisis are moments of truth. And even if we, and I'm really talking about generally, we as human beings can sometimes accommodate ourselves to the reality, whatever that reality may be, but the reality that we know is filled with all the systemic inequalities that we are familiar with theoretically. I think that this reality is becoming so blatant, so glaring, that perhaps it will become less possible to accommodate ourselves, and perhaps it will encourage people to act, to really act differently, not to only deal with what's available, what can be done, what can be reformed, but what can be truly transformed, because we have no choice, because there's no choice. So I think that would be the lesson, both the remembrance of things past and I don't know, the boldness to not only dream but craft and make and see that there's absolutely nothing to lose. There's nothing to lose. We have, and even if we thought we had, this is so fragile, this is so vulnerable, this is so weak that we don't have, actually, we systematically, we don't have anything to lose. And it's interesting to see how the world is looking at the, the underdog places, namely the African continent, and what is not happening there, or what is not so catastrophic as was expected or even desired. And we are witnessing the shift, even the shift in the gaze, right? I just read about the US that has gone over 100,000 people killed by the virus. So maybe other locations, understudied, underappreciated, or mischaracterized locations will become places of possibilities. Like the old continent where I'm speaking from is really getting old right now. It's not only a phrase to say the old continent. So perhaps like let's look at other places and places of possibilities. That would be the main lesson for me in the middle of the crisis.
Professor Soumahoro, that was beautifully stated. Thank you so much, and I think that it's generative. I would like to give other participants an opportunity to respond to Professor Soumahoro before I do. Yes, Dr. Nixon.
Thank you so much for that. That was really beautiful. And I think that one of the lessons for me has been, really trying to root self and community in a kind of care, because we've had to figure out how to do organizing differently because we've been under lockdown. We also had strict orders in Trinidad and Tobago not to be out except for essential workers. And so when we think about our own activism and our movement building and how we want to be there for others and even do our work, and as a teacher, we've had to be really creative. We have to think creatively about how we support others and how we show up. And I also think those of us who are in the academy, how do we use our voice and write about these issues and draw attention to it and offer critique and analysis and interventions in spaces like newspapers, on various ways that we could be in media. So there have been lessons for me, and that is how I show up anyway, but it was a reminder of how important it is for us to show up, and that we have to take every opportunity to radically change the structures that don't work for us. And I think we are seeing the bowels of capitalism and the neoliberal agendas that don't work. And so we have to seize this opportunity, I think, and create the changes that we want. And I really hope that that's what we can do. But of course, we can't wait for our governments to do that, because they won't, especially governments that are mired in structural adjustment and IMF and World Bank debt. And so, there's a way that we have to step up and think about how we're going to create a radically different future. And I think it offers us a moment to think about what is sustainability. What does regional solidarity and local investment look like? What does it mean for us to really understand and think about the intersections of class, race, gender, geographic location, ability, religion, sexuality, and so on? And really how we invest in ourselves as people of the African diaspora. That's also something that I think we need to think about overall.
Thank you so much, Professor Nixon. Dr. Kamugisha, did you want to say something? You have to unmute yourself,
Yes. Not specifically. I mean, I thought it's good to see you again, Maboula. I thought the response was really beautifully and well put. I think that by now we, 2 generations after independence and post-colonial bourgeois elite domination, we know exactly what we expect our post-independence leaders in the Caribbean and Africa to actually proffer to us in terms of solutions for these problems. I mean, there are quislings of imperialism. They are part of what Walter Rodden used to call the comprador elite. They're very willing to sell out our lives and their citizens' lives to Western capital. And that's obvious by now. So we know that the solutions are not going to come there. We know the solutions are going to come from the working people of the country, from radical organizations, from the feminist movement. These are where the solutions are going to emerge. And I think that this crisis has sharpened the need to do more and to usher in the new world that we all yearn for into being.
Well, so yes, I take your point and actually agree with just about everything you've just said. So, but let me push back just a bit. So then how do we engage with supranational organizations, transnational organizations, which purportedly exist for the purpose of promoting the interests of our communities, in particular, the African Union and CARICOM? How do we, what should our relationship be? Do we look to these organizations? Let me rephrase the question. Is the possibility of reform existent, or do we have to work outside of these structures?
There's not much that one can do with those structures. You do what you can, but at the same time, you understand that the focus of your energy and commitment can never be there. In other words, I am a citizen of the Caribbean, and that means that there are certain rights and responsibilities that CARICOM and the Caribbean community have towards me. I'm not going to let them forsake those rights and responsibilities. But at the same time, I'm not going to make my great focus of energy and change to be actually trying to reform those institutions, because I know the interests that they serve.
Anyone else?
Yeah, I'll speak. I'm sorry, it's getting dark here, and I don't know how to light the place. So
That's a wonderful picture, Professor Edu. Please proceed.
Yeah, I think I agree with my colleague that I'm not sure the AU is reformable. I'm not sure it's an institution that we should rely upon just based on its model, whether its functions. I think we have to really dig deep and just be really creative, think of something that hasn't been done before, or go back to what we have done that has worked in the past. And I agree, I don't think we can depend on the elite or the middle class to sort this out for us. It's not gonna be the elite and the middle class. And I don't think it can be these structures or in institutions and modes for governance that we have inherited and adopted or been forced to adopt. I'm a bit cynical though, so I'll stop there.
I understand that, but I think that, and I appreciate that your response, because it gestures toward, it's necessary to critique, it's necessary to complain, it's necessary to protest, it's necessary to, quote unquote, speak truth to power. But as Professor Soumahoro has beautifully stated, if anything, the pandemic has illuminated the truth. We're looking at truth. This is where we really are as a series of linked communities. And I very much concur and resonate with the desire to move beyond, to take advantage of this moment to create something new, to create something different. And I think that's where we need to kind of redirect our energies and our foci. That is to say, in this moment, how can we reimagine this world? Because I quite agree with all the critiques that have gone before me, that this is that it's clearly not working for us as a linked group of communities. And I simply have no desire to just continue to operate within an ongoing situation in which I'm just constantly complaining and constantly in distress. And in the case of the United States, it's just one thing after another every day, from the so-called president to young Black people being killed by the police, to being killed by just citizens, just people who feel that they have the right to just take your life. It's just really, really incredible what we're experiencing all around the world. And this is a moment for us to not simply reflect and not simply to, critique and to be righteous, but to rethink and to have the courage to do it, to have the courage to move forward. So,
sorry, can I add just one little thing to that?
You certainly can add more than one little thing.
Yeah, I would say, I think also to, Capoeira has this, the Afro-Brazilian martial art that comes out of Brazil, but this idea that you have to keep moving too, right? So even as we're creating, it's to realize that as we're creating, we can't stop at that. Once we've created something new, right? We have to always constantly be working on it and tweaking it and I guess let it continue to evolve, right? Because it's when we stop that's the moment that we can got, if I can say it that way, or allow the kind of sliding back into, or so I just wanted to add that part, that we should create, and it needs something that continues to evolve and be created.
Thank you very much, Professor Edu. And what I'd like to do now is to give each of you an opportunity as we wrap up the session. Give you a couple of minutes to reflect upon what we've discussed and to make any points that we did not make, to give us the benefit of your thoughts at this point. And would anyone like to begin? Yes, Professor Soumahoro. You have to unmute yourself,
Okay.
There you are. Now we're good.
Okay.
Yes.
Thank you. I wasn't here for the rest of the discussion, so I don't know what was mentioned, but I do remember that in the list of questions that Laurie Lambert sent to us, there was supposed to be a discussion around, our personal and individual experience of this moment of the crisis. So I think that it ties into what you just said, Professor Gomez. I think that we can, that would be more of a question. Of course, we can grow tired of the never-ending critique and the questioning and pinpointing what is going wrong and what has been going wrong for centuries in this part of the world, at least. But I think that we also need to admit and recognize that we have even built our careers over this critique, and that we are part of academia, of this intellectual world, transnational, diasporic, whatever you want, but we are part of that and we're living off that. So one of my deepest dilemmas that has not existed only today, but that has been made more visible because of today, is really the individual and personal negotiation of all those tensions. How do we actually, write, publish, conduct research, try to unveil things that that we do not discover, but that we can contribute to further circulate and make more, available to larger numbers of people. But how do you negotiate that with living simply as a human being? How do you survive that? How do you live? How do you live with an increased awareness of the, the dark times? Do we seize the opportunity to write, scathing, Tribune or op-ed and a new book, a new article that we can get to be published in a prestigious journal that is going to advance our career, or things like do we maximize? Is it resistance to gain something from the current situation, saying, I'm have this critical analysis of this and that, but I'm still going to gain from the situation? That's one thing, and the other thing is, how do you manage it? How do you live? How do you, as a human being? Because the crisis is serious. Serious, existentially, and like we're in the middle of something, and so I don't know if this is an answer, but this has been on my mind. How do you go through? How do you survive, even though we are only too aware of all those moments of survival? Equal times, worst times, where during which the African diaspora and the members have survived. But in 2020, I'm in awe. I'm thinking all the more, how did they survive? Because this is, I don't know, this is not only about some intellectual exercise and deeply understanding. It's also about experiencing, feeling as a human being. So how do you not break down? How do you keep sane? How do you maintain hope? How do you, gather strength to dream and to do, to make, to do? So on the one hand, we can find the comfort in the history that I've mentioned. And we can say that the African diaspora is precisely better positioned because it has oftentimes operated in the margins. It has taken the alternative route. That's the theory. In practice, because now we are the African diaspora today, still in the margins, still, more or less. And what do we do in concrete terms? And how do we live day by day?
Thank you, Dr. Soumahoro. Thank you for your directness and for your honesty. Anyone else? Yes. Let's see, who do we have here? Yes, Dr. Kamugisha.
Yes. I just think two things that I really come out for me out of the situation as a responsibility that we have to continue to clarify and reinforce structural conditions that lead to vulnerability of certain populations, which COVID has made so clear, and the fact that healthcare is a human right, and it should not be commodified in the way that it is around the world. So I'll say those are two of the things that become very searingly that I think are part of our responsibility to continue to push. Since I would say the times are surreal and strange. I found personally that I've been going between bursts of work and periods of quite incredible lethargy, which I'm sure that everybody is experiencing. I'll give you a quip. Last Wednesday, the University of the West Indies promoted me to full professor. Okay.
Oh, congratulations.
Yes, and it was one of these surreal moments because I got called by a senior colleague who told me the news, who was at the meeting. I said, yes, we'd usually take you out and get you drunk, but, physical distancing. So we'll have to wait 6 months.
Right.
But yes, it became this moment in which my family's overseas and everything. So I was there, oh, what can I do? So I went to the beach, by myself. That's all I could do. But I mean, I do think that we should also find courage in the fact that this moment will also pass on some level. And yes, and I guess that's all I can say. Yeah.
Thank you so much. Would anyone else like to comment? Dr. Nixon, would you like to comment?
I would.
Oh, yeah, I'm sorry. Yes, Professor Brito.
No problem. I would like to thank Maboula for her talk. I also would like to tell that I love your Marielle Franco shirt. But was really important what you said, because I have been thinking during this pandemic that sometimes I have been saying we cannot be, especially here in Brazil, the way that the Black population was educated, we cannot be naive anymore. Obviously costing our lives, I have been talking a lot to my partner who is African American. I tell him, see if it was an African American can see how this is about race quickly, right? Because of the way that the society deal with race, but how in Brazil, not for me and my colleagues, but how for the general population, and it emphasizes the fact that we are in a majority, like 54% of the population is Black, how we embrace some conservative agendas, believing that we could fit in those agendas. So during the pandemic last week, again, a 14-year boy was killed in Rio de Janeiro. He was in the house with his cousins while the family was working, and the police entered in the house, attacked the house, surrounded the house, entered in the house, and shoot randomly the walls. And one of those bullets reached the back of this 14-year-old. And called my attention something that the father said. And the father of this little boy said, my son was a child of God, meaning was an evangelical family. My son was a child of God. I was, and he did this gesture several times, like he was putting, something on his boy mind, like I was preparing him to be a lawyer. So this family had all these plans for this little boy. And while we were still suffering from this 14-year-old, the next day, the police killed another 18-year-old at this time, while he was donating food in his community. So I think, of course, I'm not blaming us for anything, but there is a naivety in our minds that if we do everything right, this society has a place for us. So while we are dealing with this pandemic, most of the people who are dying are Black people, dying alone because the families cannot perform the rituals of each religion. We are at the same time dealing with the same, police brutality. There is a report about directed to Black people about how to, you know, keep it safe during the pandemic. In one of the message of the report is directly to Black men, telling Black men to prefer the hospital mask because all the mask can put the Black men in trouble. So prefer to use it. So it's in an official document written by scholars. So we know in the society that we are living in. At the same time, that's what I would like to mention briefly. Dr. Nixon mentioned it about white supremacy and how transnationally white conservative groups are already connected in building a transnational agenda. So now Brazil has connections with Ukraine, with Russia, and the United States, although the United States forbade the entrance of Brazilians in the United States since last Friday, and now government don't have a reciprocity policy. That's what I would like to make sure that I talk. So we have the protocols for the spread of use of chloroquine, which I just found out last week that is a cheap medicine. So basically we are being tested from light. Now the doctors at public hospitals can use chloroquine in patients from, even if they have light symptoms or having symptoms. And we are also dealing with political violent crisis in a moment that the government centered in the president is trying to arm the population. I really would like to say this here because it has to do, I'm not exaggerating, it has to do with what we will see that will happen in Brazil. Since last week, in a meeting with the other ministers, and thanks to the Supreme Court, we had access to this meeting. The president is basically trying to do the same that is happening in the United States with these militia groups in front of the Capitol houses, threatening governors and mayors. So in our case in Brazil, although little by little the laws of guns access are becoming more and more flexible, now the president is defending that everybody should have a gun. And we know it's not everybody. A Black man was killed in Brazil years ago carrying an umbrella. And the police said, oh, we thought it was a gun. So he is defending, the president is defending, but now the population have guns. And I will not say we because I know that don't involve me or people like me. And the population can defend themselves from governors and protest against the lockdown policies. So and during these protests in Brazil, they carry American flags and Israel flags. Now Ukraine flags. So the conservative groups, the white supremacy is united. And really, and even this Brazilian middle class who now is crying because cannot go to the United States, they have a plan. They have a clear political plan for the Black populations transnationally. So in this term that I'm saying, at least in Brazil, we don't have time for distractions. And I think that the challenge we have seen on current condition under this pandemic in terms of education, violence, police violence, work, on worker rights, gender. We don't have, it's urgent to have this transnational dialogue and clarity about how we will face this plan, I'm every day convinced that I'm not being paranoid of the white supremacy, the supremacists through the Black populations around the diaspora. That's it. But the challenge is how we survive as individuals, Dr. Maboula, to this, in this stage of sadness. Yeah, thank you.
Thank you. Thank you, Dr. Brito. Now, we're running out of time. We're perilously close to the end. So there are several who have not spoken. I want to give you an opportunity to provide us with your final thoughts.
Thank you.
Oh, go ahead.
Oh, yeah, just to say that I do think just responding to the need for a balance of self-care, community care, and then thinking about how we show up. I mean, I'm an activist first and a writer, and so I'm always thinking about how I can best use whatever privilege I have in order to make a difference, whether it's using my voice or organizing and working with others and bringing groups together. And I think that we have an opportunity to work regionally and, you know, across distance, even in the midst of this crisis and epidemic. We know that capitalism is not working. Capitalism will not save us, and neoliberal agendas and policies will not save us. And so I think we have to put forward solutions and build across difference to figure out the best thing for our individual countries, but I think also regionally. I think South to South interdependence is a way forward. And I think that we have to root out the anti-Black racism that fuels so much of the discord and so much of the hate and so much of the roots of white supremacy that continue to impact all of our spaces in the African diaspora overall. And I think that those are some of the ways that we, and amidst all of that, we also have to think about how we survive and how we care for each other. And so I just want to say thank you to everyone on this panel. This was a really important discussion, and I hope it is the second one of many that will follow. So thank you.
Thank you, Professor Nixon. Dr. Edu.
Yeah. Just very briefly, I think we do need to talk, find ways to talk about race on the continent in ways that make it thinkable and tangible and real for folks. And I say this because there's a way in which I keep hearing people lauding Trump as an example. And this kind of I've seen this in different groups, like Make Africa Great Again. So just disrupting why and how Trump becomes a model of anything and a particular source of critique of the world in this moment. And also just thinking about how do we bring this kind of raw directness to, I think that as a professor, to our students. And it's hurtful when I do it. I think in many ways it's necessary and helpful so that we stop being surprised and stop each pandemic or each incident can stop being truth, right? Because we've been knowing this. We know that this is what it is. It's been like this for a long time. So it doesn't need to continue to shock us, and we can actually start working and start creating and start being creative and imaginative and dream and build what we want to see. So thank you again for putting this together. Thank you to all the participants. Thank you to my amazing colleagues. Thank you.
Thank you, Professor Edu. Professor Fobil, you have the last word.
The last one, I want to say thank you to colleagues, panel members, your audience, and everyone for having us and for giving us the opportunity and for listening to us. We hope that this will continue. This shouldn't be listening, so that we can once in a while gather together and share ideas and best practices. Thank you for the opportunity.
Thank you.
Thank you, Professor Fobil. And I want to thank all of the participants. I thought we had a very productive discussion, at moments intense, very challenging. And so let's hope that we can go forward and make something out of it, do something with it, both in our lives individually and in our collective selves, in our communities, associations, and so forth. And once again, we want to thank ASWAD for sponsoring this forum on COVID-19 in the African diaspora. Once again, want to thank the members of the committee, Laurie Lambert, Ben Talton, Bryce Henson, Ana Lucia Araujo, for bringing this together. And I want to thank the audience for your presence, and hopefully we will meet again. Everyone take care, be safe. Have a good day or evening.
Okay.
Thank you.
Thank you.
Thanks,
Bye.
everyone.
Bye-bye.
Thank you.
Bye.